name is Erin Hayes, and my chosen topic is structural racism in the healthcare system during COVID 19. Structural racism is the normalization and legitimization of an array of dynamics, historical, cultural, institutional, and interpersonal, that routinely advantage whites while producing cumulative and chronic adverse outcomes for people of color. It is a system of hierarchy and inequality primarily characterized by white supremacy. The treatment, privilege, and power for white people at the expense of Black, Latino, Asian, Pacific Islander, Native American, Arab, and other racially oppressed people. Once COVID 19 was added to the already occurring system of oppression, the evidence of it became more apparent. COVID 19 showed multiple problems within the American healthcare system. African American people were dying at a rate of 1 to 4 of COVID 19 because of the existing health disparities. According to APB research, Pacific Islanders, Latino, Black, and Indonesian Americans all have a COVID 19 death rate double or more of that of white and Asian Americans who experience the lowest age adjusted rates. One of the factors that cause this is the people with better insurance frequently get better health care, not to mention the low funded hospitals in poorer communities. With Medicaid not covering everything and most poor minorities simply not being able to afford their medicines or the copay of their insurance, some people struggle to decipher between, are they going to pay their rent, are they going to buy their medicine, or are they going to get food? And medicine sometimes always gets put out of the mix and is medicine that they need. The number one cause of the people dying from corona is badly treated by underlying conditions seen in poorer people. Black people, by genetics, have higher incidences of blood pressure and diabetes, or sometimes both, causing some to struggle to manage their blood sugars. This connects to the fact that some doctors will prescribe people with diabetes or high blood sugars things like going to the gym, to work out, or only eating fresh fruits and fresh vegetables to manage their weight. If they can't afford to go to the gym and lose weight or to simply buy fresh fruit, how are they going to manage their condition? Causing this to be a never-ending cycle. Poor health care in minority communities started long before corona arrived in the USA. These communities are affected by the food deserts in poorer parts of the nation. However, in more affluent communities, the access to health care that is given to wealthier and healthier populations that has proven to be majority white Americans, which is not a coincidence. You can also see around 5 different grocery stores on one block in these neighborhoods. This shows that Black people with underlying conditions most likely can't take care of their bodies because of the resources to do so aren't around them. The issue of healthcare is significant in 2021 because 2020 opened the eyes of many people and showed that there is a great divide between various racial groups. Week 1 was about who had true power in the United States. I believe that the people that have true power are the companies and organizations that make large donations to the representatives and senators in Congress that control the U.S. government. I say this because upper and middle class, majority white people that are benefiting from the advantages are only accepting what is given to them. The government and the government officials are the ones that have the power to change the disparities in the healthcare system, schools, neighborhoods, and etc. I know this to be true because since the abolishment of slavery, there have been many policies and actions put in place to keep minorities where they are today, such as the making of the ghettos, by redlining in the Black communities, the 13th Amendment, which allows the government to incarcerate and enslave those deemed to have broken the law, and many wars on Native Americans to take their land and put them on reservations. If these problems were created by the ideas and ideals of the ones in power, then they can be changed by them as well. An example of a racial injustice in the healthcare system is from Monique Tello, MD, which she is telling a story of a patient she has. And she said, a patient of mine recently shared a story with me about her visit to an emergency room a few years ago. She had a painful medical condition. The the emergency room staff not only did not treat her pain, but she recounted them treating her like she was trying to play them. Like I was just trying to get pain meds out of them. They didn't try to make any diagnosis or help her at all. They couldn't get rid of her fast enough. There was nothing in the history that suggests she was a pain medication seeking person. She was a middle aged, church going lady who had never had issues with substance abuse. Eventually, she received a diagnosis and appropriate health care somewhere else. She is convinced that she was treated that poorly by the medical room staff because she was black. There are even doctors that will act in this manner and still feel that they are treating every patient equally. This illustrates some of the negative assumptions formed from racism by doctors, even when they are unaware of the discrimination they are adding to their patients' care. When thinking of this situation, think of this happening to many African Americans trying to seek help in a packed, stress-filled hospital during a pandemic. Another cause of the racial disparities seen during COVID-19 is essential workers. For most majority minority families, working from home was not an option, and not having a job was also not an option. Minority families were first to go to work because they were essential workers, and every day they had to risk bringing back COVID to their homes because they needed to provide for their kids or they needed to keep their home. Social media, in my opinion, has played a vital role in informing people of all ethnicities of the racial disparities in the healthcare system. On TikTok, a social app, there are videos of women telling stories from all around the world with the saying, "Doctors are to women as cops are to black men." A story I've seen recently that resonated with me the most is a story of a pregnant black woman that came into the hospital because she felt uncomfort in her belly. Upon minutes after getting checked in, she was rushed into the ER because the baby's umbilical cord was cutting off blood circulation. While in surgery, the lady said that she felt like somebody was laying on her chest and she couldn't breathe. She told the doctor, that happened to be white, that was operating on her repeatedly, and he did nothing. Finally, a black nurse came in for her regular checkup to see if she needed to help and heard the woman constantly saying, "I can't breathe." The nurse immediately alerted the doctor that she could not breathe and she needs help. Still to this day, the woman believes that she would have died if it wasn't for her. According to statistics, the chances of a black woman dying from childbirth is 5 times higher than that of a white woman. But these statistics are cut in half when it's a black woman and a black doctor. This is similar to the statistic of black newborn babies being 2 times likelier to die than white newborn babies during delivery. According to a study published in July of 2020, when black doctors deliver black babies, their mortality rate is cut in half, especially in complicated cases. But no one knows why this is happening. This phenomenon is the reason why there is a separation between black and white feminist groups, because the two fights just aren't the same.